Hi, everyone. I'm Norma Loeb, founder of the Lewy Body Dementia Resource Center. This video series has been created to bring awareness through firsthand experience of people living with Lewy body dementia, their caregivers, and through expert physicians. This crucial information will be shared with healthcare professionals, with families, and the general public to heighten awareness and to enable correct diagnosis. Please know we are here to help you every single day on our live helpline. I thank you for watching.
I was a principal at the time, and it was actually right before retirement. I started seeing changes in myself as far as decision-making, problem-solving. I was a principal of a 1,200 student school. I never second-guessed myself. I always felt very confident, and I started to see things deteriorating again several years before I retired, and I was 62 years old at the time. And I was a little nervous about it. I didn't know about Lewy bodies. I really didn't know. I heard of Alzheimer's before, but I really knew nothing about them.
14 years ago, both my husband and our adult son, though our son was only 16 at the time, and I thought that Paul had developed a phobia of some sort because he was very fearful of driving and became a terrible driver, and I had to take over. He thought he had developed a phobia. He went back to therapy to try to deal with his phobia of driving. But then when we were on vacation down in Belize, we were walking on a dock, and the dock had to be 20 feet wide to go down to a boat. And he wouldn't walk on the dock because he was afraid to fall off. And now that I know about Lewy body dementia, I realize that all these fears and all this perception of falling and a lot of fears like that were the beginning of the visual distortions that were happening in his brain.
Early signs that we see in dementia with Lewy bodies are changes in cognition, which can be changes in memory, whether it's short-term memory or long-term memory. It can be changes in executive function and ability to plan or balance a checkbook or perform multiple step commands can be difficult early on. We oftentimes see changes in sleep patterns. So something called REM behavior disorder starts fairly early on in dementia with Lewy bodies. And really what that entails is while someone's sleeping, typically their body is actually fairly paralyzed, so they don't act out their dreams. But in this condition called REM behavior disorder, or RBD, patients tend to start acting out their dreams and yelling while they're sleeping. And that can actually lead to injury if their dream involves them chasing something or reaching for something. And they can actually fall out of bed. They can swing their arms and hit a lamp, hit a desk, or even hit their spouse. And so this specific disorder is really only seen in Parkinson's and dementia with Lewy bodies. It's not really seen in other disorders. But on top of those symptoms, we can see changes in personality, in behavior, they can develop hallucinations or delusions. They can develop what's called Capgras syndrome, which is essentially inability to recognize a significant other, someone they've known for a very long time. You may not recognize their face or think that they're somebody else. Patients can also develop more anxiety, more frustration, even if they've never really had these symptoms before, and even if there's no trigger for them. So these are all symptoms that you can see in dementia with Lewy bodies. Some of those are more or less specific for dementia with Lewy bodies, but some are non-specific and can be seen in multiple other conditions.
The second form of early sign that I had was walking to a gate at a airport. And the further I walked towards the gate, the more I was losing control of my legs and ending up kind of in a stooped position. And the TSA attendant gave me a cane, which helped a tremendous amount. And I use a cane to this day. to help with that.
Some of the earliest signs that my mom showed of Lewy body dementia came before and right after my younger brother died of pancreatic cancer. She was having trouble tracking some things, and she asked me for help with her checkbook, which she normally had a lot of pride in doing herself. She had a few times where she told my other brother and I that she had some hallucinations. She had a lumpectomy for breast cancer, and we thought they were probably caused by the medication she was on post-surgery. And so we kind of dismissed those hallucinations, but then she was asking for more help. I noticed a little bit of a tremor in her hand, but not much at all. Depth perception was causing trouble for her, and she thought something was wrong with her eyes. And then she told me she would sometimes see little bunnies hopping on the hallway next to her in the carpet, and those hallucinations. So my brother and I continued to just pursue evaluating her. And then she was eventually diagnosed with Lewy body dementia.
And in December, out of nowhere, all of a sudden I got lost, hallucinations, major trembling, every imaginable Lewy body symptom all at one time. And it was obviously scary, and we had to go to the emergency room. And they did not diagnose me. They really couldn't figure it out. And the family doctor sent me to a neurologist. And then once I heard that those prior symptoms were related, that was really new news to me. And also a runny nose. I've had a runny nose for years. No one ever said it was related.
As people probably know by now, I was first diagnosed with Alzheimer's. And I was told I had Alzheimer's and to use it or lose it. That was it. I was given all the advice. And it wasn't until a couple of years down the line, because my wife Elaine's been a carer, professional carer for 30 years. She thought there's something wrong here. This is not Alzheimer's, not as I know it. And I was quite lucky to talk to a consultant from Newcastle who's done a lot of research on Lewy bodies. And when I explained about the hallucinations, the symptoms, the hallucinations and the night terrors, and the smells of smelling things and seeing things that aren't there, the consultant said, this lad he's not got Alzheimer's, he's got Lewy bodies, because the symptoms are hallucinations, more so in Lewy bodies than any other dementias, and seeing things that really are there. I really see them, but nobody else does, and also smells and hearing things like people's voices, and it was petrifying. But once I knew what it was, I could do my research is what I did, because when I first had Alzheimer's, or when I was told I had Alzheimer's, I'm what kind of these people that you wouldn't go to war without knowing your enemy. So I learned as much as I could about Alzheimer's, and then next thing I know, I had Lewy bodies and not Alzheimer's. So I had to do it all again. But it was worthwhile doing that while I was still in the early stages.
I think there has been a misdiagnosis, because the concept of Lewy body is much later than like Alzheimer's. People weren't even talking about Lewy body disease as the second most common form of dementia until the 1990s. And so there is much less of an awareness. And I think that, everything that's cognitive impairment is not Alzheimer's. There are multiple forms of dementia. And the misdiagnosis is from both misinformation, lack of knowledge, as well as overlap, right? So there are overlaps with Alzheimer's disease, with Parkinson's disease, and with delirium. So because of the overlap, because of the symptoms where maybe somebody with Lewy body doesn't have as serious cognitive deficits early, but it may be more attention, visual, spatial, sleep, depression. So it can be misleading.
When we first started to question what was going on with our dad, it was very frustrating for us because we looked back at some of his medical records and the referrals that he was getting for individual symptoms of what turned out later to be Lewy body. Those things started about 10 years before his diagnosis. We knew he had restless leg syndrome. We knew he had, eventually he started with the REM sleep disorder. And what else then he started losing his memory and we started putting together the pieces of the puzzle.
Repeating himself a lot.
But doctors were very interested in their separate diagnoses and no one really put together. As a matter of fact, when we look back on his medical records, someone says, consider Lewy body dementia, and no one referred him or followed through.
Well, it took me a long time to get my diagnosis because even though the doctor I went to was an expert, she said, I really think I know what you have, but I don't want to put a name on it yet. And this other neurologist I went to gave me a different kind of dementia. But when I finally, my insurance wouldn't pay for a lot of the tests. So my doctor couldn't verify that you had Lewy body. It took me 3 years to get my insurance company to agree to do a DAT scan. And through that, they saw the tangles and the things in my brain that they call probable dementia with Lewy bodies. The only other way to say you do have Lewy bodies is to do an autopsy on my brain.
He may have been misdiagnosed from the beginning, and but honestly, I'm a nurse, but I never heard about Lewy body dementia, so that didn't even occur to me. I thought it was early Alzheimer's, and we took him to the urologist. As I said, he did a slow test, and then he decided it was early cognitive decline. And then we took him to a functional medicine doctor who gave him a whole set of herbal supplements. But they also did a lot of tests, including the genes, checking his genes and, a whole set of blood tests.
Where we got her to the first doctors, neurologists, and the neuropsych exams. And they were even very cautious. They didn't want to say, this is this or this is that. In fact, Lewy body wasn't even, the diagnosis that they came up with was that she's got major depression. That's the biggest thing. And she has some mild cognitive problems. And from her CAT scan, there was, they did see vascular injuries. So her diagnosis was dementia, mild cognitive impairment, Alzheimer's, and vascular mixed dementia. Not Lewy body, I don't think, they never even mentioned it.
Diagnosing Lewy body can be a little bit of a challenge for a number of reasons. So first is that different people are different. So depending on other diseases or conditions that someone may have, it can be more or less challenging to see the same symptoms in different people, right? If you also have arthritis, if you also had a stroke, if you also had some other problem, then it could be a little bit more challenging. Different people could be on different medicines. Also, the disease can just present differently, either early on or later. Some people have all sort of the textbook symptoms that one would read about, but some people have some of them. Some people never get hallucinations. Some people see things and they hear things and not just see. Some people have a lot more Parkinsonism, in other words, stiffness and movement, rigidity, difficulty walking. Some people either never really get that or they get that very late. And some of this, we don't really understand why it happens. Some of it is that people who have Lewy body very, very often have at least one other disease in the brain at the same time. Many people with Lewy body also have Alzheimer's disease at the same time. Many people with Lewy body have blood vessel damage in the brain or vascular dementia at the same time. And then there are other factors that we don't even understand. There's a pretty wide variety